My name's Helen Pass. I'm the chief of breast surgery at NYU Langone Hospital. And it's really a pleasure to give this talk. October is one of my favorite months because everybody has a reminder to focus on their breast health. And I think that's what's most important. I titled this talk Everything You Wanted to Know, but Were Afraid to Ask, because there's a lot of myths and misconceptions out there. So really what I want to do is hop through a whole variety of topics. I'm going to cover them pretty fast because I think none of these are very complex, and I'd rather get through a lot of points quickly than just belabor a few points. So let's start with really what is a breast? Totally not sexy at all. A breast is actually a sweat gland that's been modified and grows into breast tissue. Really, I always love to say the proof is in the pictures, not that probably any of us are pathologists, but you can see that usually there's a duct and the actual gland. And in a sweat gland, there's the gland that makes the sweat that comes up the duct. In a breast, there's these glands that make the milk that come up the duct. And that's why we always talk about two different things in breast: duct pathology, glandular pathology, and then all this supporting tissue around. So breasts are really lumpy bumpy because that's what they are. You have this normal fatty tissue that is wrapped around these breast lobules or glands with these tubular structures coming through them. So this is why when you do a self-breast exam, or as I said, examine yourself in the shower, that things can feel lumpy bumpy. The American Cancer Society got rid of the recommendations for a self-breast exam on a monthly basis, but they do say you should be self-aware. Most women who feel a lump, it's very rarely during a true formal self-breast exam. It's more normal to feel it when you're putting on lotion, soaping up in the shower when you're nice and slippery. And that's why you want to know the general architecture of your breast tissue, so that if something's different, you can really focus in on it. Breasts come in all different sizes and shapes, from very small to very large, to very dangly, to very perky. There's no one right or wrong size or shape. Development ends somewhere around 19 years of age. It's true, women seem to be developing breasts at a younger age, but really what happens is before puberty, we have lots of ducts, but no milk glands. With puberty, the glandular tissue starts to develop. And by the end of puberty, we have all the little milk glands we're going to need. And these are what swell when we get pregnant. These are what swell during breastfeeding. And that's why women in early pregnancy actually get breast engorgement. And obviously with breastfeeding, that can happen again. If you remember, I said your breasts are glands draped in fat. So breast size does vary with weight. I tell people, unfortunately, when you lose weight, you may lose it first in your breasts and not in your belly. And I think most people would rather it the other way around. But this is also a reminder to say, if you've gained weight recently and you've had to buy bigger clothes, don't forget to buy a bigger bra. Just because your bra stretches with you, it doesn't mean it'll be comfortable or supportive. And so again, remember, that's a part of your body that's going to gain or lose weight. And that may also change how symptoms present. Sometimes with great weight loss, whether intentional or unintentional, you'll find things that you couldn't feel before. So lumps that may have been hidden under the fat become apparent. We see this after a lot of weight loss and dieting. We also see it after bariatric surgery. So again, the fat can obscure things. Now, I already went to this little part already that if it fit me then, it should fit me now as well. But your breast will change size and shape multiple times during your life, not just with puberty, not just with pregnancy and lactation, but also just with your normal ups and downs in your weight. So again, I caution people if they're getting unusual breast pain, if things feel tight, think about it and think about changing your bra. I wish I had an exercise that would either make your breasts perkier or make them firmer or make them bigger. These are a bunch of ads basically from the 50s and 60s where they marketed all of this stuff to try to increase breast size or reduce breast size or make your breast perkier. But once these ligaments stretch out, you're never going to get a perky breast again without the help of surgery. Breast size does not affect breast cancer risk. I wish I could tell you that if you had a really small breast, you were less likely to get breast cancer. The flip side is I can reassure you that if you have a fairly generous breast, you're not more likely to get breast cancer. They've actually looked at studies, and women who get a reduction don't reduce their risk of breast because they still have breast tissue there. And that's why even men can get breast cancer, even though they don't have large breasts, they still have breast tissue. And also, no matter what you've been led to believe, perfection is unusual. So breasts are really not symmetric. I always say they're like snowflakes where no two are alike. And really what we know is one statistic said 97% of women have different size breasts, but about 25% of women will have one cup size difference. That's why in the store you'll see so many of those little um, clothing helpers, as I like to call them, but those little pads and push-up pads that you can put in. It's just like your feet. One's normally a little bigger than the other, and you know when you go to buy shoes, you have to fit them to one foot or the other first. So same thing, it's not uncommon for breasts to be asymmetric. If it's significant enough that it impairs your ability to dress and feel comfortable about it, you can either use a pad in the smaller size or think about corrective surgery. Now, that's a caution. If your breasts have always been one size and one breast suddenly either starts to shrink or enlarge, that is a concerning finding. So we always talk about change is bad. But if you've always been that way, then that's probably not a bad finding. I also like to point out that many odd findings are normal. So I'm going to excuse in advance if anybody's eating lunch. But first of all, many people ask me, well, I've got all these little bumps around my nipple. In medicine, we love to come up with big fancy terms for everything, but these are called Montgomery tubercles. And these little things are actually glands that secrete oil to lubricate the nipple during breastfeeding. But because they're oil containing glands, sometimes the oil can get blocked in here and you can even get a white head or a black head. It's sort of like anything else on your face. Don't pinch it or squeeze it. You'll just irritate it and push as much in or out. You can use a warm compress. Don't go opening it up. Don't go picking it. And again, these normal little bumpy things are very usual. Hair is very usual on the chest, but that's not why I'm showing this. I'm showing this little extra nipple here. So what we have in embryology is a milk line, just like our animals. So before we're born, we have nipples going all the way from the armpit down to the belly button. And sometimes they all don't regress, and you can end up with an extra nipple again. I've seen them anywhere from the armpit all the way down. They sometimes run in families. In some cultures, these are viewed as a sign of virility. But the other thing to be aware of is if you get a little lump or bump around it, there's usually a little bit of breast tissue stuck underneath that extra nipple. And so you should also pay attention to that. Nipples are like belly buttons. They can be innies or outies. 10 to 20% of people have inverted nipples. It's not a wrong thing or a right thing. Lactation consultants can help you learn how to breastfeed if you have an inverted nipple. And so again, it's just how you're put together. So as I was talking about, hair around the nipples, very usual and normal. If you choose to remove it, just make sure you use antiseptics because again, those open pores can get infected. That can lead to a breast infection. And then finally, as I said, just like nipples can run from the armpit to the breast, little rests of breast tissue can run from the armpit all the way down to the abdomen. It's most common in the armpit. We call this accessory breast tissue. It can swell during pregnancy and lactation. It can get uncomfortable because the milk, if you don't have a nipple there, doesn't have a way to get out. It can also gain in size and shrink in size as you gain or lose weight, just like normal breast tissue. It's not a dangerous thing. It's no more dangerous than having breasts. Some people don't like it because it's cosmetically displeasing to them because they find it difficult to wear sleeveless shirts. But again, it's a normal finding and a normal variant. So there are lots of myths surrounding bras. Is a bra bad for your health? Is wearing a bra all day, every day, some people even sleeping in bras bad? And the answer is no. So again, we love data. Constricting your breast in a bra and preventing the toxins from leaving, which was the argument about why bra wearing was bad, is not a real thing. It's not a true thing. And it's no more likely to cause breast cancer than wearing socks is to cause toe cancer. So again, your bra's not bad. It's there for comfort. And that's what I tell people. Size, fit, underwire, no underwire. It's really a matter of personal preference. It's really a matter of comfort. If it's comfortable, it's good. If it's uncomfortable, then you need to look at a different size and fit. The other myth out there is that antiperspirants and deodorants cause breast cancer. And the thinking goes, well, women shave their armpits and then put antiperspirants and deodorants directly on the shaved skin, which allows it to be absorbed. And rather than causing armpit cancer, it somehow is causing breast cancer. Men don't shave. So even though they use antiperspirants and deodorants, it's going on in intact skin, and therefore they're not getting breast cancer. There's a couple of problems with this. First of all, women who don't shave and in cultures where they don't shave still get breast cancer as well. And second of all, men, whether they shave or not, still get breast cancer, although at a smaller rate. And that's because they have ducts, but not glands. And that's why their risk of breast cancer is so much lower. Now, this little picture here is to help me remember to tell you the reason that people have tried to say that antiperspirants and deodorants cause breast cancer is common in women, and use of antiperspirants and deodorants is common in women. So two common things collide, but one doesn't cause the other. And the best way I can explain it is like my statistics professor did to me. He said, clearly toilet paper causes hemorrhoids because they never have met a hemorrhoid sufferer who didn't use toilet paper. And the answer is no, that's true, not related. Both things are true, but one's not causing the other. There's a lot of other myths out there. So in the United States, there was the whole myth that bras cause cancer. In France, they actually believe that you shouldn't wear a bra because wearing a bra makes your breasts lazy and it causes them to sag. There's also the myth that if you sleep on your stomach, you'll flatten your breasts. If you sleep on the side and they list to one side, they'll sag. That sleeping in a breast doesn't allow them to breathe and it's bad. Sleeping position has nothing to do with anything except comfort. And if you're a stomach sleeper or a side sleeper, you're not doing anything bad for your breast health. I've harped on this a few times, but it's amazing how many people come in with breast pain and you see these marks from their underwire or from their bra band where it's dug into them and they don't understand why they have this burning pain or tingling pain or just even regular pain. So if you're getting indentations in your shoulders, if you have marks around your back, if you're falling out of your bra, they're all saying you're the wrong size. Now, I did say if it's comfortable, go ahead and do it, but most people would be more comfortable in the correct size. Now, how about women with small breasts? Well, even women with modest breasts should consider wearing a supportive garment during exercise. So they put sensors on women and had them do aerobic exercise. And what they found is even a woman with an A-cup breast, it moves up and down 3 inches with up and down exercise. So again, support is there to help prevent chafing of the nipples because of chronic rubbing, prevent nipple itchiness, and actually prevent pain. Now, your family history influences your breasts in many ways. Factors come from both parents, so we do care about your dad's side of the family, and it affects both size and genetics. Your mom may be short and you may be tall because tall runs in your dad's side of the family. Same thing, your mom may have big or small breasts, but your breast size may come from your dad's side of the family. Significantly, if your dad's side of the family has a big family history of breast cancer, you can't say, well, that's just in men. And so you want to know and make sure you're aware from both sides. However, and this is also important because it's amazing how many times I've heard patients say, well, you know what? I don't have to worry about breast cancer because there's no cancer in my family. Only 10 to 15% of women with breast cancer have a family history of hereditary breast cancer. Very, very busy gift. But what it really shows is that 10 to 15% of patients have breast cancer, have a known found mutation. And of that, the BRCA genes are the most common, but we've got genes now way beyond BRCA. I have patients who tell me, well, I did a 23andMe test, so I don't have the gene. But really what 23andMe tests for is the BRCA gene but only the 3 specific mutations found in women of Ashkenazi descent. So it doesn't look for some of the other common BRCA mutations, and it definitely doesn't test for all of these. Also, direct-to-consumer testing is not only incomplete because it doesn't test for anything, but in a couple studies that have been done, wrong 40% of the time, misclassifying what we call a variant of uncertain significance. We see a change, we don't think it's important, we need to reclassify it as something that, oh my gosh, you're destined to get breast cancer. Or as I said, missing things that were important. So for people who need, want, are curious about it, they shouldn't just pick up an over-the-counter test. They should actually undergo genetic counseling and have formal testing. Unfortunately, we still don't know why people get breast cancer. However, we do know many of the risk factors that lead to the development of breast cancer, and these are things, some we can control and some we can't. So I can't do October without going through a few statistics. I think everybody knows 1 in 8 women will get breast cancer in their lifetime. The flip side is 7 of 8 women won't. In 2023, that's over 350,000 women will get breast cancer. Over 43,000 women will die this year. And more surprisingly, every 2 minutes, a woman's diagnosed with breast cancer. More importantly, for the first time, female breast cancer is now overtaking lung cancer worldwide. And so it used to be, because smoking was so ubiquitous, lung cancer was the most common. But now the incidence of breast cancer in countries, even where the rates have been historically low, are increasing. And that's unfortunately because they are now adopting more and more Western lifestyle. They're starting to have more instances of obesity, physical inactivity, fatty food and alcohol consumption, delaying childbearing, having fewer children, and breastfeeding less. And we know that all of those increase your risk for breast cancer. And so again, unfortunately, as people adopt a Western way of life, their risk of breast cancer is increasing as well. Now, your 2 biggest risks of breast cancer you can't affect. You can't affect if you were born with a female gender, and you can't, and we hope you don't want to affect aging. Everybody should get older. That's a good thing. So just being a woman is the biggest risk factor for developing breast cancer. 1 in 8 women, but only 1 in 800 men develop breast cancer. And that's because a woman's breast development takes 3 to 4 years. Their breasts, once they're fully formed, these glandular cells that can make breast milk are immature, and they're sitting there waiting for environmental stimuli to tell them that, oh boy, you should start making milk. And so they don't undergo their final development or differentiation in our terms until your first full term pregnancy. And so during this time, they're responsive to both the good and the bad environmental factors. Men's breasts rarely fully form. Most of what you see is fat. They have ducts, but really not glands. So since the glands are what are sensitive to environmental factors, most of the men's breast cells are inactive, and they also tend to have lower levels of estrogen, whereas women tend to have higher levels of estrogen and are more sensitive to the estrogen disruptors in the environment. As I said, we hope everybody gets old. Every birthday's a good birthday. And you can see here that your risk of breast cancer goes up and peaks somewhere around 72. However, it remains incredibly high even in the 80s. So no, you're not too old to get breast cancer. We'll get into the, are you too old to get a mammogram? And the answer is no. As long as you're relatively healthy and driving and enjoying life and you expect to live another 5 years, you probably should just go ahead and keep getting your mammogram, because it's easier to treat a small cancer than a large cancer. But again, the longer we live, the higher the rate, because we've also had more time to develop cancer, to be exposed to cancer causing agents. And as we get even older, we're less capable of repairing the damage that happens to our cells. And that's why cancer risk goes up. So we're seeing an increased risk of cancer in the young, but 2 out of 3 women are still diagnosed after the age of 55. Now, other things we really can't control. You can't control your race and ethnicity. We know that white women are more likely to develop breast cancer than Black women, but they tend to be diagnosed at an older age, whereas breast cancer is much more prevalent, and Black women have the highest breast cancer rates in women under 40. They have the highest rates of triple negative, most aggressive form of breast cancer, and they tend to have a death rate that's twice as high as white women at the same age. They're also more likely to die from breast cancer than white women at any age. So there's some push to say that Black women should consider screening at even a younger age. I'm glad to see that the US Preventative Task Force changed their recommendation from starting screening at 50 to starting screening at 40. And depending on family history, some people are advocating that Black women may consider screening at even a younger age. Flip side is Asian, Hispanic, and Pacific Islander women have a lower risk of breast cancer. And we are seeing some change in that as, especially in the Asian and Pacific Islander women, start to adapt a more Western lifestyle. So we don't know how much of it is due to a genetic component and some of it's due to lifestyle choices. But this is what we know today. Now, we talked about hormones, but let's break it down just a little more. The longer your breast tissue is exposed to estrogen, the higher the risk of getting breast cancer. So that's why the younger you are when you get your period, the older you are when you go through menopause, and the older you are when you have your first pregnancy, those all increase your risk of breast cancer. Now, most of these are not things that we can control, and we're not advocating get pregnant at a young age just to protect your breast from cancer. So I usually say most of that we can't control. Also, just to sort of support the link between estrogens and breast cancer, infertile women and women with polycystic ovarian syndrome are reported to have a lower risk of breast cancer. But that brings me up to the top of the slide also. What about these chemicals and products and hormone disruptors? What do we know about them? I'll get to that in a little bit. I just wanted to go back through the stuff that we can't control. So having no children raises your risk of breast cancer, and also having children later in life increases your breast cancer. Why is that? It's because your first full-term pregnancy causes the final maturation of your breast cells. Also, the more times you're pregnant, the fewer menstrual cycles you have. So that's why women who have more live births have a lower risk of breast cancer than those that just have a few. And you have to study these women and follow them for a long time because the protection doesn't happen at that young age of pregnancy. It happens later in life. I think this bottom thing in blue is also very important. The data has been sometimes misrepresented to say that abortion increases your risk of breast cancer. But we found that not to be true. In the Scandinavian countries, where everything is covered through their national healthcare program, they have great accounting for those who have undergone an abortion and those who have gotten breast cancer, and they've not been able to prove a link. When they've done a similar review in the United States, because a lot of abortions are done private pay prior to the existing insurance, there's not a full accounting of women who have had an abortion, but women who develop breast cancer are more likely to relate a history of having an abortion. And they think it's because of those reasons that the data in the US has shown a bit of a weak link between abortion and breast cancer risk, whereas in countries when we have full data, there's no link. So again, I want to go back to, from my review of the literature and data, abortion does not influence your breast cancer risk. Breastfeeding. Well, I would like to go on record as saying that fed is best and breastfeeding is great for the mom and the baby. But again, for women who are unsuccessful at it for a variety of reasons, no shame in that either. Breastfeeding protects breast health because your breast making milk is changing the way the cell machinery works that makes it more resistant to the influence of these external carcinogens. It also usually shuts down your menstrual cycle, although remember, it's not a good form of contraception, resulting in overall lower estrogen levels. They also believe that when you're breastfeeding, people are just living healthier. They tend not to be drinking alcohol. They tend to be paying more attention to their diet. And not surprising, the longer you breastfeed, the more protective it is for your breast. And particularly women with a family history, prolonged breastfeeding seems to be a nice protective resource. So let's get to these endocrine disruptors. We've got many. We've got medical hormones, and we've got chemical hormones. So let's first start with medical hormones. Oral contraceptive pills do slightly increase your risk of breast cancer. Having said that, the increased risk is low. We have to balance it against the risk of an unwanted pregnancy. And also, people who take oral contraceptive pills have a protection from colorectal and ovarian cancers. So when they do the big studies and they try to balance competing risks, what they decided was that the protection from colorectal and ovarian cancer was greater than the slight increased risk of breast cancer. And that's why oral contraceptive pills still exist on the market, because the benefits outweighed the harms. So they still remain a valuable option for women for a variety of reasons, be it regulating their menses period, be it for pregnancy protection, or women who take 10 years of oral contraceptive pills seem to have a significant decrease in their ovarian cancer risk, which may be important in those with a family history of ovarian cancer. Now, we have combination and estrogen-only hormone receptor treatment. So Prempro is probably the biggest brand name of combination HRT. We know that it does increase your risk of breast cancer, and that the risk is related to how long you use it and when you start it. So women who started initially at the time of menopause, so at a younger age, and take it for that limited period of when their menopausal symptoms are the worst, seem to have the lowest increased risk of breast cancer. So starting it early, taking it for less than 2 years does not seem to increase your risk. Taking it for more than 10 years or starting it later in life definitely seems to increase your risk. It's hard to actually give you a what percent because the data is slightly variable. And somewhere between 2 and 5 years, it increases your risk. How much? But I also warn women that they're more than just their breast. And so it really depends on quality of life. And there are many women who say, I acknowledge there's a slight increased risk of breast cancer, but quality of life trumps this increased risk that may never be realized. So I also tell people, figure out why you're taking your HRT and figure out, is there a drug that's not hormone dependent that you can take instead? We have better drugs for bone health. The original data that said they thought it would protect your heart from heart attacks and your brain from strokes has not been validated, so it's not thought to prevent that. And the original hope that it would prevent Alzheimer's has not been proven. So if you're taking it to prevent a stroke, a heart attack, or Alzheimer's, you're taking it for the wrong reason. Now, estrogen-only hormone replacement therapy, which you should only be on if you no longer have a uterus. So if you've had a hysterectomy, you can take it. The reason you can't take it if you still have a uterus is prolonged use of estrogen alone dramatically increases your risk of uterine cancer because it's causing that uterine lining to grow out of control. It'll also give you infrequent but potentially horrendous menses. So estrogen alone does not increase your risk of breast cancer. And that's also why I say our BRCA positive patients who've had risk reducing surgery with removing their ovaries, tubes, and uterus can go on HRT because they're going on estrogen only, even if they have intact breasts and haven't gotten to that breast risk reduction surgery for a variety of reasons. Fortunately, fertility treatments do not seem to increase breast cancer risk. They've looked at this many ways, and maybe very high dose for multiple cycles but you can tell how equivocal I am on that. But it doesn't mean that you shouldn't be a little more aware if you've done that. And same thing for those who had DES or a DES babies, probably a slightly increased risk. But again, the data's all over and I can't give you a percent increase. We also know that many chemicals are endocrine disruptors. So we know that the parabens found in makeup and food preservatives, some of the toxic chemicals in our carpets and paints and floorings, some of the disinfectants and solvents and pesticides all really do contain these endocrine disruptors. Europe's way ahead of us on banning products. But it seems to make a lot of sense that if you can, you should. And that's why they're like, use glass containers for microwaving and storing beverages. Again, use things with adequate ventilation. Now, chemical exposure, again, you can swing data any way you want. I like that it's no studies so far show a direct connection between pesticide exposure and an increased risk of breast cancer. And then I still have, but you know what? Female farm workers definitely have an increased incidence of a bunch of medical conditions. So definitely lymphoma has been linked and breast cancer has been lightly linked. Some of the most commonly used pesticides are estrogen mimics in laboratory animals. So are we really sure? And like one of the chemicals used to grow corn increases estrogen production by turning on the aromatase enzyme, which is a specific enzyme we use with aromatase inhibitors, the estrogen blocking pills we use in women with postmenopausal breast cancer. So it's like, Also, research shows that some of the chemicals in plastic products, like the big one was plastic baby bottles had bisphenol A that leached into the liquids, causing cancer. Especially heating things in plastic seems to really cause these chemicals to leach, which is why ceramic or glass is better, especially make sure it's lead-free ceramics. And again, we know that this BPA is a weak synthetic estrogen and really can either block or promote estrogen synthesis, throwing off the whole hormonal balance. So again, if you can avoid these things, it makes a lot of sense. Now, fat. Fat is a place where in the periphery, we see that estrogen precursors can be converted into estrogen. So again, this peripheral conversion is where it happens. So women after menopause go, but I don't have my ovaries. I don't understand how I can have a high estrogen level. And I'm like, well, but you still have the capacity to make estrogen, just not from your ovaries. And what we can see is that the serum levels of estradiol really vary based on a patient's BMI, and 29 is not that high. Also, women who are overweight have higher blood insulin levels and IGF, the insulin growth factor levels, that really seem to create a microenvironment favorable to tumor development. And that's why we're paying more and more attention to that. The flip side is weight loss has been associated with a lower breast cancer risk, and that is very heartening that there's something we can do. And yes, it's true. Carrying weight around your midline, which tends to be a marker of high insulin growth factor levels, is worse than having a pear. So pears are better than apples in cardiovascular health and breast health. So again, weight loss is good. Women who lose weight and keep it off have a lower risk of breast cancer than women whose weights stay the same. And again, I like it when things make sense from a biology standpoint. So if the more weight you lose, the lower your risk. That tends to make sense because there's less fat. We would think less peripheral conversion, less estrogen in there. And so if this was just random numbers, it wouldn't make sense from a mechanistic standpoint. So I like that. And whether you lose weight naturally, whether you lose weight naturally with bariatric surgery, or whether you lose weight naturally with the help of now some of these newer medications, it all seems to be advantageous. So again, trying to get to a normal BMI is one of the things that's great for your overall health, but definitely your breast health. Now, if you're premenopausal, being overweight seems to be protective. And that's because paradoxically, in premenopausal women, excess weight seems to decrease estrogen production, tends to be associated with polycystic ovary system. So these polycystic ovaries tend to decrease your estrogen production, tend to increase testosterone, change your estrogen balance. A lot of it's not well understood. Again, I'm not saying women who are before menopause should choose to be overweight. I'm just pointing out that nothing's as simple and as straightforward as we seem. Now, you can't affect how tall you are, but taller women are more likely to develop breast cancer, and nobody's sure why this is the case. But again, it's just one of those risk factors that we've acknowledged. Let's talk about something we can affect, and that's diet. Diet's thought to be responsible for 30 to 40% of all cancers, not just breast cancer. Breast cancer is less common in countries where the typical diet is plant-based and low in total fat. So in Asian countries where their protein portion tends to be much smaller, fish is emphasized in their diet, red meat is less so. There's a lot of plant in most of their meals. They tended to have a lower incidence of breast cancer. When they migrated to the mainland and started to adopt a Western diet, or now that they're staying in their own countries, and especially in Japan, where obesity is increasing, Westernization of their diet is increasing, the incidence of breast cancer is going up. And again, a high-fat diet's been shown to increase the risk of breast cancer. Is it the high-fat diet itself, or is it that more people have a higher BMI if they tend to ingest a lot of fats? We don't know. However, protection only came with an incredibly restrictive low-fat diet with fat making up less than 15% of calories, and that's really restrictive if you read the back of any label. Intermittent fasting has been shown to decrease the risk of breast cancer, and also for women with breast cancer, increase the efficacy of chemotherapy. So this intermittent fasting is really a new area of research and a very intriguing option for people. Alrighty, now I'm going to be the no fun police. Alcohol does increase your risk of breast cancer, and breast cancer risk rises with every drink. Women who drink one alcoholic beverage a day have a 7 to 10% increased risk of breast cancer versus non-drinkers. Women who drink 2 to 3 alcoholic beverages per day has a 20% increased risk of breast cancer. And even women who drink only on the weekend, I have 1 to 2 glasses of wine per week, increases the risk of breast cancer, and that low amount can increase the risk of breast cancer recurrence in women with early stage disease. So you can see the correlation. I also want to caution women that you have to be aware of serving size. So there was always a gag gift in Bed Bath & Beyond when it used to exist in person, that the glass was the size of a full bottle of wine. And I'm like, yeah, no, you have to look at servings. So really a pour of wine is about 125 to 175 mLs. So, that's 5 ounces, not quite 6, because 6 ounces is 180 mLs. Same thing, beer, wine, distilled spirits, a shot is usually 3 ounces. So, it's a half a shot of distilled spirits is what they consider a standard drink. Alrighty, moving on to more of our vices. Smoking. The data is inconsistent. Smoking is linked to both a higher and lower risk of breast cancer. They've shown that women who smoke tend to be thinner, it used to be believed, which may be why they have lower estrogen levels and less breast cancer. It's also thought that maybe it does decrease your risk of breast cancer directly, but there are flip sides that have shown women who have a heavy secondhand smoke exposure may increase their risk of breast cancer. I would never tell somebody to smoke to prevent breast cancer. Again, smoking has so many medical harms that probably stopping smoking, at least so you don't expose your loved ones to secondhand smoke and increase their risk of breast cancer should be where the focus is. Let's look at something else we can control: exercise. Research has shown that exercise regularly for 4 to 7 hours per week, not per day, lowers the risk of breast cancer. The Women's Health Initiative, which was a large study full of nurses who kept food logs and activity logs and submitted their health data, showed that walking briskly for as little as 2.5 hours a week can decrease the risk of breast cancer by almost 20%. So that's a half hour a day for 5 days a week. You can then make it up. If you've got a rainy day, you can do 45 minutes the next day. This is really a very doable ask. And I mean, 1.25 hours, get out there 3 days, you're going to make it. So not only does exercise tend to lower your IGF levels, improve your mood, but it also seems to probably help with maintaining a normal weight or losing weight, especially after menopause. And that's why, again, is it the exercise directly? Yes, because it's lowering your IGF, but it's also just a component of healthy lifestyle that across the board will lower your risk of breast cancer. Now, other things you can't control: breast density. If you have dense breasts, you're more likely to have an increased risk of breast cancer. And that's because this is a marker of estrogen exposure. Fatty breast, nice and gray, you can see anything. We talk about fibroglandular dense, a little fibrous tissue, but really pretty easy to see. Heterogeneously dense, so you've got this white-gray pattern, and then very dense, you have all this white out. So a positive correlation really exists between how dense your breasts are and what your breast cancer risk is. And we think that it's because it's a marker of how much estrogen's in your system. So that's why it seems like women with dense breasts tend to have better bone density because they probably have higher estrogen levels. But it also makes mammographic screening less sensitive. I always tell people, so what do you think this is? Like, it's a box with a little bitty black dot? Nope, actually it's a polar bear in a snowstorm, and all you're seeing is their nose. You can't see the polar bear because it's really blocking out everything. So that's why mammographic screening is less sensitive. Bad things on a mammogram show up white against a white background. You're going to have a harder time seeing it. That's why we also tell women with dense breast, you should get a screening ultrasound. So let's quickly look at a few other risk factors. Well, if you've had a personal history of breast cancer, once your breast tissue has shown us you can make breast cancer once, it means the rest of your breast tissue can make cancer again. A history of a benign biopsy showing a high-risk lesion. If you've ever been told you have atypia or lobular carcinoma in situ, you will have an increased risk of breast cancer as well. And you should be working with your providers to figure out what's the right screening and what's the best way to lower your risk. Also, your risk if you have these benign things is higher if you're younger and if you have a positive family history or if you have more than one lesion. Also, this very rare group, people who've had therapeutic radiation to their chest. Usually people have had radiation for lymphoma. Occasionally people have had it for lung cancer, but that's usually at an older age and seems to be less important. You should be talking to your provider about what other screening you should be getting. Now, let's look at some good things. NSAIDs and aspirin are neither protective nor bad for your breast. We've looked at many things. Aspirin does seem to protect against colon cancer, but if you take it when you're older, it increases your risk of bleeding. They've discouraged women from taking it for cardiovascular protection. So again, most of the time, the primary care providers are saying aspirin shouldn't be taken routinely just for health prevention. But the flip side is there's no harm if you need an aspirin or a Motrin, ibuprofen, Advil, which are the NSAIDs for pain. You can take them. You're not going to harm your breast. Very strangely, there is a correlation between antibiotic use and breast cancer. Now, again, is this causation? Are we back to deodorants cause breast cancer? Or is it just there's a correlation? And what they think is people who are accessing medical practices are more likely to get antibiotics, and these are more likely the people who are going to comply and get screening mammograms. So we haven't been able to show that antibiotics cause breast cancer. If you run across that, again, they don't think it's causal. They just think it correlates with people who are more often getting medical care. Now, according to the NCI, they looked at it because this was a big thing in the literature that hair dye does not, there's no conclusive evidence that hair dye increases the risk of breast cancer. However, chemical straighteners, because they are a more potent and different chemical, they say the data is still limited. There was some data that says that people who both dye and straighten their hair may have the highest risk at all. And as I said, underwire bras, deodorants, antiperspirants, caffeine, using a microwave, using your cell phone, putting your cell phone in your bra, none of those seem to cause breast cancer. There is one unfortunate thing. Data has shown that exposure to light at night may increase your breast cancer risk. So people who work the night shift seem to have an increased risk of breast cancer. So factory workers, people in the hospitals seem to have a higher risk of breast cancer if they work the night shift than people who work during the day. Also, people who have a lot of street lights versus living out in rural areas seem to have a higher incidence of breast cancer. But again, we get into the whole, is it environmental pollutions? Are there other issues going on? And what people are tending to think is maybe this is related to the melatonin levels. So when women work at night, their melatonin levels tend to stay low because it's affecting their pineal gland, because dark is a trigger for your pineal gland to secrete melatonin, which is then supposed to make you tired and want to go to bed. So again, you can't help it if you work the night shift, nothing you can actually do, but just stuff to stay tuned in the detail. Oh, the flip side is that's another reason though you shouldn't keep your TV on at night, is because it's screwing up your sleep hygiene and maybe screwing up your breasts. So if I can ask one last thing in my waning minutes here, get your mammogram. I'm sorry, I can't give a breast talk without giving a commercial for mammography. If you're at average risk, start at 40. As I said, I was pleased to see that the U.S. Preventative Task Force has decreased their recommendation from 50 to 40. Now, they still say get it every 2 years. All the other groups say do it every year. Honestly, I think it's too hard to remember. Do I get a mammogram on my even years or my odd years? Just get it every year. The amount of radiation you're getting from a mammogram is extraordinarily low. It's the same as you would get if you fly from New York to California. So if you're not afraid of flying and getting that radiation, then you shouldn't be afraid of getting your mammogram. Plus, let's face it, you usually have to come home. So one round trip flight, you've gotten more radiation than you have on getting your mammogram. Again, I say do it every year. If you have any of those high risk conditions, you should be talking to your provider and asking them, should you be doing something else? So should you be getting supplemental MRIs? You should do it yearly, and you should do it until your life expectancy is less than 5 years. You're not too old to get a mammogram. If you're out driving around and playing golf, if you are still enjoying life and are relatively healthy, even if you're over 80, if I find a small lesion on a mammogram that I can treat with a simple lumpectomy as an outpatient, that's a lot better than going ahead and waiting till it becomes a lump you found while bathing that may have had a chance to spread. And then again, if you're dense at an ultrasound, I really, really apologize, and I don't have any control over it, that Medicare has now decided that women of Medicare age who have dense breasts aren't worthy of an ultrasound. 1/3 of women of Medicare age still have dense breast, and it's sometimes just a matter of how you were put together. So although dense breasts are more common in younger women, it's not uncommon in older women. And I think they made a mistake there, but unfortunately, I can't control that. And again, the earlier we find breast cancer, the less treatment you need and the more we can save. So when mammography was discovered in the 70s and really became mainstream in the 80s, we started to see a decrease in mortality. And since 1990, when routine screening was really a factor, breast cancer mortality has dropped by a third. Now, we also have better treatments, so it's not all attributable to your mammograms, but clearly finding something small and early when it's much more treatable. I will put in my other commercial and say, you shouldn't be afraid of what we find. Women are like, I don't want to get a mammogram because I'm afraid you're going to find something. Again, finding it before you did, finding it when it's small, gives you so many more options. We already talked about a bunch of the myths, but regular mammograms do help. Yes, you may have a friend who got their mammogram every year and still came up with a lump between mammograms, but that's the uncommon scenario, and it doesn't mean routine mammograms don't find way more cancers than they miss. Again, it's finding a cancer usually 3 to 5 years before it can be felt and at a much smaller size. It's finding it at the size of an M&M or slightly smaller, whereas with your fingers, if you're skinny and really good with your fingers, you have to have something the size of a quarter. And if you're not so adept at it, it could be even the size of a $50 before you find it. Mammograms don't cause cancer. As I said, the amount of radiation you get is very small. Mammograms aren't perfect. Yes, many people end up with a biopsy that doesn't show cancer. Mammograms have missed cancer, but they're still the best test we have. MRIs are not a great screening test. They're not as sensitive for the earliest form, the non-invasive form of cancer, the DCIS that we like to find that has a 98% survival. MRIs have a lot of false positives. They find a lot of things that make women get biopsies, but aren't cancer. So MRIs are reserved for very select patients and aren't replacing mammograms. Same thing. Oh, my breasts are dense. Why don't I just get the ultrasound? I don't need a mammogram anyways. No, no, no. Even if your breasts are dense, get a mammogram because we'll still see things that the ultrasound will miss. They're additive tests. One does not replace the other. And mammograms are painful. Yes, they can be uncomfortable. Compression is involved. I tell people if you find it really, really painful, take a Tylenol or an Advil before you go. You can help reduce that. Bring an ice pack with you so that afterwards you can slip an ice pack in your bra. Well, obviously bring two, so that it will help. The reason they pull your breast so far forward is the only way we know we get all of the breast tissue in a mammogram is if we get all the way back and see the muscle along the chest wall. So yes, it's temporary discomfort. Yes, I wish I had a better test that didn't just need compression. Yes, I wish we had tests that never missed a cancer. But right now, it's the best test we get. Start every year at 40 and keep going until you're no longer well. So I'll get off my soapbox and I'm going to turn it slightly over to Cheryl because she will hopefully be moderating through the chat and can tell me any questions that are there.
Thank you very much, Dr. Pass. I have one question in the Q&A. Thank you very much for this great and informative presentation. In a small, dense breast, how is it possible that you have a negative biopsy which is discordant with images produced by ultrasound?
So again, disclaimer, I can't give you specific medical information, but discordant means that what they see on their imaging study does not match what the pathologist found. So let's say they see a round lump and the biopsy shows something that's not a round lump, fatty tissue, fibrostroma. It could be that that round lump was firm enough that when the needle went to biopsy it, it bounced off the firm lump and into the tissue around it. So a good radiologist is going to always look and say, did the pathologist find something that explains what I'm seeing on imaging? And if not, it needs to be rebiopsied and we need to figure out the best way. So it doesn't matter breast size. Again, discordance happens in big breast, little breast. It really is the radiologist being appropriately diligent and saying, just because the needle didn't find something, maybe the needle didn't hit the right spot.
Breast implants and increased breast cancer risk. Also, what is the best breast cancer screening modality?
So for women with implants, mammography is still the best screening, assuming we're talking about women who have implants placed for cosmetic reasons. If you've had a mastectomy and had an implant, we don't recommend routine screening. You have to know if you're getting a screening mammogram and you have implants put in to make your breast bigger. Instead of taking 2 pictures, they will automatically take 4 pictures. So side to side, top to bottom with your implant in its normal position, and then they'll pull the tissue forward. We call it an implant displaced view, and take 2 more. So that tends to be the best. Implants do not increase your risk of breast cancer. Implants may, and it depends on what type, and it depends on the duration, and the FDA is still trying to figure this out, cause a slight increased risk of a very specific lymphoma that seems to start in the capsule that grows around your implant. So it's really not even the breast tissue, it's the response to the implant that starts to grow in an unregulated fashion. Most often in women with textured implants, but there have been case reports in women without textured implants. The FDA does not advise women who are happy with their cosmetic outcome and have no symptoms, get them removed or changed out. It's just more a caution that if you start developing swelling around your implant, that we know that this exists and we work it up appropriately.
And is it true that there is a higher risk for breast cancer on Long Island?
So the answer is yes, but the answer is not because of environmental pollution. So they did an exhaustive 20-year study and said that the reason the incidence of breast cancer is higher in Long Island is because we have more women with an ethnic background that predisposes them, Ashkenazi Jewish women. We have more women with a family history. We have more women with unhealthy lifestyle because the more affluent population tends to potentially have more undesirable health habits, and that it's the confluence of those events and not the environment in Long Island per se. Having said that, though, it's interesting that the other highest per capita locations for breast cancer are on the other island of the Sound, along Connecticut and that Connecticut, Massachusetts, Rhode Island border as well.
Does hormone therapy cause breast cancer? For example, Synthroid or any thyroid hormones. Also, do carbs cause dense breasts?
So non-estrogen containing hormones, insulin, thyroid medicine have had no link to breast cancer. And again, the good outweighs the bad. If you need thyroid replacement, you need thyroid replacement. And carbs per se have not been linked. Very fascinating nutritional research being done. I could do a whole hour on nutrition because they actually just looked at a study where they found that, and this was, I'm sorry, in men, not women, because I have no idea why a lot of research is done in men, that men who had an Atkins diet with no carbs actually had worse health outcomes than men who had up to 40% of their diet in carbs, looking at all-cause mortality. I'm hoping they were just trying to get multiple publications and they'll give us the female data for that as well. But no link from carbs, just a link with weight. Well, thank you everybody for all your time. And again, if I convinced even one person who's been afraid to get a mammogram today or got one woman to join up with a buddy and start a walking program, I will feel like I did a great job today.